patient safety is a top priority for Lake Charles Memorial. Today I'm joined by our Chief Medical Officer, Dr. Manley Jordan. And Dr. Jordan, thanks for joining us today.
Thank you. I appreciate you asking me to be part of the program.
You're about half a year into your new position as Chief Medical Officer. How's it been so far?
You know, I could use a lot of adjectives to describe it. It's been obviously very interesting, challenging, but rewarding would probably come to the top of the list. But I have to tell my patients who are watching, I want to thank them for allowing me to be part of their lives, and I still miss them. But I've enjoyed this transition, and it has been very, very interesting, and it's been fun.
Well, one of the transitions you've been focusing on is patient safety and increasing that in Lake Charles Memorial. Tell us sort of your plans.
You know, I think we're trying to align our goals with patients and their families' expectations. And quite simply, patients should be able to expect three things. Number one, to do no harm. They don't want to be harmed when they come to the hospital. Number two, they want to be healed. And number three, they want to be treated nicely. So those are our goals, and those are very reasonable expectations by patients and their families, but putting them into practice is quite difficult given the complexity of the hospital system.
Well, Dr. Jordan, you talked about the three expectations patients have when it comes to their safety in the hospital. Now, how do you implement a plan to help protect that patient?
Obviously, one of our biggest concerns is health-associated infections. We try to standardize removing devices such as Foley catheters, central lines, which are catheters and vessels, to try to reduce infections. We also are implementing measures to try to decrease delirium, which can lead to falls. So it's a concentrated effort. You have to make it a point of emphasis, but we are trying to standardize that more and more to where it doesn't get missed.
Dr. Jordan, you talked about hospital-acquired infections, and the proper use of antibiotics comes into play there. What is your plan when it comes to that?
Certainly, appropriate antibiotic utilization is receiving more and more focus. Recently, you've heard about the superbug, where it's resistant to all known antibiotics. So appropriate utilization and stewardship of antibiotics is very important. Antibiotics are appropriately utilized when you use the right amount for the right duration. Too little can harm patients, but also too long or too much medication can be harmful. So we're focusing on appropriate utilization and stewardship of antibiotics.
Well, obviously, one of the big aspects of when people come to our hospital is to treat them and send them back home. And you have new protocols to help do that and heal the patient.
Right. With more and more research being done, we have identified best practices or evidence-based medicine. And we're trying to apply that in a more standardized, uniform way. Examples of applying the science of best practice would be in certain conditions like heart attack. We know that certain medications, when given at certain time periods, you improve outcomes, particularly survivability of a heart attack. Congestive heart failure is another disease process that we've identified certain types of medications that improve outcomes. So we're trying to make this a standardized part of treatment, and not relying so much on just hoping people order the right things, but trying to apply the evidence-based or the science to the evidence-based practice of medicine.
Well, obviously, the third aspect is when people come, treating them and healing them, but also they expect to be treated with respect. And how do you go about ensuring our nurses and our doctors do that? You know,
I think the last expectations that certainly we'd like to meet is patients being treated nicely. And any quality program, particularly if you talk about a service industry, and healthcare is a service industry, you can divide quality into two components: the content and the delivery of that service. In healthcare, the delivery of the service is the patient experience or their satisfaction. It's so important that CMS has developed a survey that most people are familiar with. It's called HCAHPS, which is an acronym. But HCAHPS is a survey administered to patients after discharge and inquiring about their expectations and if they were met or not. These questions center around communication with doctors and nurses. It centers around the discharge process and how well the patient and the family understands and is comfortable with the discharge process. It has to do with the environment and how clean the environment is and how quiet. So it is very much an important part of what we do, because certainly being respectful to patients, without that healthcare has fallen short.
Well, Dr. Jordan, as you well know, that building a better patient experience is kind of our motto around here, and that goes from the building to the facility to the care they received. And how do you go about building that better patient experience?
You know, engagement is a buzzword these days. Engagement means getting everybody involved, and clearly it's going to take a team effort. It's going to be the doctors with the nurses, with the technicians, with dietary, and also very important is including the patient and the patient family as part of that team. So I think the answer is going to be a collaboration, and with that we feel like we're going to continue to be successful.